Hi dear students, in this special series on subject-wise strategy, we are going to identify all the important topics that you must keep in mind before you start working on a subject. We'll be looking at the trend for each subject and then mapping it to all the tasks in the app so that you can prepare better and score better. In this video, we will look at the subject preparation strategy for periodontology. Now, Perio is relatively an easy topic because it comes with a lot of clinical questions which are very straightforward. There is not much of a preparation that goes in understanding the basics, the tissues, because dental histology covers that part, and then you have plaque calculus and a few gingivitis and periodontitis with regards to the clinical features. The important and the more difficult part that students find challenging is the surgical periodontology and implants. So your focus should be around easier topics first. Make sure that you master the easy topics first and then move on to advanced topics. But in order to understand what is important, what is not important, let's take a look at the weightage of Perio first and the kind of questions you can expect. Now the proposed weightage for Perio in NEET MDS is 14 questions, and the number of questions have been pretty consistent over the past 6 NEET MDS exams. There are chances you will see more questions from Perio than expected. So make sure that this is one of your stronger subjects and you're giving it the right amount of time in preparation. Now on the left, we have all the topics that you need to cover for Perio, starting from the basics to the more advanced topics, including implants. And on the right, we have all the questions that have been asked in the past NEET MDS exam. So let's review these questions quickly. We will not go into the depth of the explanation or the strategy to solve a question. Our main aim is to see which questions fall into which categories and what should be your strategy to prepare. Now the first question is: a mentally retarded patient with medication on epilepsy presents with gingival enlargement. Identify the diagnosis. So that's gingival enlargement. Then Merin's classification, which is associated with recall. So that's diagnosis, prognosis and treatment plan. Main causative organism in aggressive periodontitis is AA. Keystone pathogen in periodontitis, P. gingivalis. Characteristic feature of INUG is punched out crater-like depressions at the crest of interdental papillae. Then we have a 12-year-old with Papillon-Lefevre syndrome. This question will also be relevant with oral path. Then a very striking feature of gingival enlargement with phenytoin in a 10-year-old with epilepsy. Difference between periodontal and pulpal abscess can be achieved or differentiated with vitality test. Neutrophils in GCF are orogranulocytes. The rate of resorption by osteoclast at osteotomy site is 25 to 50 micrometers per day. Then implant, which penetrates through cortical plates and passes through full thickness of alveolar bone, is called a transosteal implant. This is the classification of implants. The keratinized gingiva is composed of marginal and attached gingiva. Value of biologic width around implant. Periodontitis is the 6th complication of diabetes. 2 statements regarding additive and subtractive osseous surgery and to see which one is true or false. Patient has poor oral hygiene and has lifesaver shaped lesions. These are McCall's festoons. Bruchite is most commonly seen in which region? So that's mandibular anteriors. You can see these questions are pretty straightforward. There is no complicated, complex language also. So preparing for Perio is easy, but you have to be more confident and vigilant when you are reading the questions in Perio. Cause-related periodontal therapy is phase 1. Then a female patient reported with ulcer on her gums. She had a radiating pain associated with fever, malaise. This is all infectious. INUG. Look at the words like metallic taste, fever, etc. Brushing technique indicated in orthodontic patients is Charter's technique. Which of the following term is closely related to association between bone and ceramic based implants? It's biointegration. Reverse architecture is associated with trauma from occlusion. Tripod effect while holding the instrument, modified pen grasp. A 32-year-old healthy male patient reported with tender bleeding gums. There are heavy deposits of calculus, severe recession of gums, no lymphadenopathy, leukocytosis. All these are signs of chronic periodontitis. Organism responsible for gingivitis in pregnant women, intermedia and rectus. The new attachment, you must get well versed with these four terminologies. They are very important. Look at the explanation and the key concept. Wound with different depths and irregular margin is sutured by vertical mattress suture. Then an image-based question of UNC 15 probe. Identify the probe. Radiographic diagnosis of hypercementosis. There's an IOPA given. Which of the following keratin is present in parakeratinized and absent in orthokeratinized areas? That's gingiva and oral epithelium. Now, gingiva and oral epithelium is also covered under dental histology. In fact, all four periodontal structures, you will find more questions in DH and Perio both, right? Knives used in gingivectomy, Cochlear and Orban, 1 and 2. Plaque found in heavy calculus formers differ from that in non-calculus formers in terms of the potassium content. Drug of choice in ANUG is metronidazole. Which of the following statements is incorrect for furcation defects? Grade 3 is clinically visible. That is an incorrect statement. Then definition of materia alba. Then identification of a torque wrench which is used in implants. Make sure you go through the explanation. The explanation will tell you exactly what you need to know about the topic. Also, it comes with a video. The video explanation comes with a lot of parallel knowledge of the topic itself. It explains you how to eliminate all the incorrect options. It will tell you more regarding the other things related to that similar topic. So make sure that you are taking a note of all of this in your workbook and notes while you go through the explanatory videos. Right, so this is implants. The next question is, which bone density is best suited to achieve a minimum difference in the elastic modulus of titanium implant and the residual alveolar bone? Then identify the image. Osseointegration is shown in the image. Important concept. The following enzymes are secreted by P. gingivalis except leukotoxin. Predominant immunoglobulin in saliva. Very important question. IgA. Density of bone in anterior maxilla, D3. This table is very important. Remember this table from the key concept. Everything in the table is important. Gingival recession with lower anteriors is seen, shown in the patient. HIV positive. What is the condition? Necrotizing ulcerative periodontitis. Factor for long-standing success rate of periodontal treatment is plaque control. Next question. A patient treated for periodontal disease has furcation involvement. The patient cooperation is found to be questionable. What should be the recall? Similar, we had Merin's classification earlier. Then a patient presents with following clinical findings: an incisor with worn out incisal edge moved occlusally through the gingival attachment. What changes can occur? There will be increase in the attached gingiva. Then which of the following is the most common type of Trichomonas species in the oral cavity? T10X. Which of the following aspect is similar in periodontal bone loss and metabolic disease? Impaired neutrophil chemotaxis. Next question. AA is a member of green complex. Plaque microflora, all the complexes. This image in the key concept is very important. Make sure that you remember these microorganisms and their complexes properly. PLA and hydroxyapatite scaffolds are used in the fabrication of artificial bone graft. Which of the following implant surfaces features improve osseointegration, acid etching, surface coating and sputter deposition, all of them? Then a clinical image of implant placement using socket shield technique. This is the explanation. Okay. Look at the images and the illustrations. They will help you understand the question and the topic better. Okay. If there are any questions that you like, that you want to revise, make sure you bookmark them within the app. Resonance frequency, RFA, is important to check implant stability. Based upon the motion of the scalar tip, so this is the motion. Identify the type of scaler. It's a magnetostrictive scaler. Let's put that under periodontal instrumentation. Then a very popular image of dehiscence. You must have seen this image everywhere. Identify the type of probe used to measure the furcation, Neighbor's probe. Identify the defect. It's a 3-wall defect in the illustration. Identify the flap technique based upon the incisions marked in the dotted line. This is papilla preservation flap, where the papilla is preserved in aesthetic areas. Repeat question on enug. Similar question we had seen earlier with metallic taste, punched out lesions on the gingival papillae, generalized malaise, thick pasty saliva, halitosis. These are all classical signs of necrotizing ulcerative gingivitis. Next question. In a patient with leukemia, the reason for gingival bleeding is thrombocytopenia. Then a question on Schwartz periotriever, which will help you retrieve a broken instrument. So if the scalar tip is broken, you can use this instrument. Which of the following is the correct order for periodontal phase 4 in sequence to periodontal phases of treatment? Straightforward question. Then drug-induced gingival enlargement. This time it's cyclosporin. Earlier we had a phenytoin-based question with a 10-year-old epileptic patient. In the picture depicted in the gingival section below, identify the structures marked. This image and the illustration itself, very important. You can be asked any question on this specific image. It is discussed in detail in the explanation. Make sure you are memorizing this image and understanding it. Patient reported with this IOPA. This is segmental hyperplasia, hypercementosis. Which of the following is not a type of chisel, angle former, instrumentation? Which of the following is a secondary colonizer, Campylobacter? Which of the following is available in form of encapsulated microsphere, minocycline? Antibiotic active against all strains of A is ciprofloxacin. Chisel used in pulling action or pull stroke is Rhodes chisel. Then the most common location of a 3-wall defect is the mesial surface of upper and lower molars. Trapdoor technique is an important technique used for CT grafts. Diathermy used for resection of small nodular lesion. The principle is electrosection. Factual question. Which salivary component acts against the lipopolysaccharide? So this is defense mechanism of gingiva and host response. Bacteria in a biofilm communicate with each other by quorum sensing. Plaque microbiology. Circular epithelium is semi-permeable. Piezosurgery advantages and disadvantages. It decreases morbidity. Minimum bone width required for a 4 mm implant. This is important. 6 mm. A lot of conceptual questions can come based on this fact. Example of a soft tissue laser is diode. Which of the following is most susceptible to gingival breakdown? Interdental coal, because it's non-keratinized. Poor prognosis of furcation involvement. First maxillary premolar, because the furcation area is too far. Which of the following is available in form of encapsulated microsphere? Repeat question from 2019. Which of the following is true regarding chlorhexidine gluconate? First question on chlorhexidine, I'm surprised. It causes brown staining of teeth. Then the primary etiological factor for aggressive periodontitis is reduced immune response. There are a lot of factors with regards to aggressive periodontitis. You can go through the explanation and the video. Bone defects in aggressive periodontitis compared to chronic periodontitis is wider. Which of the following is not a part of red complex? Like I told you, complexes are important. Which of the following is a secondary colonizer, again from Perio microbiology? Which of the following causes maximum amount of connective tissue damage leading to bone loss? Subgingival plaque, which is attached to the epithelium. Initial sign of phenytoin-induced DIGO is interdental enlargement of the papilla. After periodontal flap surgery, when is the patient recalled? In 1 week. Recall, primary healing, all these phases important in perio. See another question. Epithelial attachment to root surface via hemidesmosome occurs after how much time? In 1 week. Then you will see peripheral flange in extraoral implants. Minimum bone width required for 3.7 millimeters implant. Earlier we had a 4 mm implant. Direct connection between bone and the body of implant is called osseointegration. Earlier we had seen a schematic image of osseointegration, right? Which is an indication for immediate implant placement. So the others are contraindication. Periodontal breakdown is relatively an indication. Toll-like receptors are present on all except bacterial cell. So that was the last question, and what do we find out? We see that most questions have appeared from implants. So implants are very important in perio. You will find a lot of implants on prosthetics in prosto. So make sure your preparation with implants is optimum. Now that is one topic that you have not prepared thoroughly as an undergrad student, and it is understood. But we have enough data within the app that is just enough for you to know everything about implants for the exam. So make sure that you are preparing implants from perio and prosto and solving all the questions on them. Talking of primary perio topics, so a lot of questions from plaque and microorganisms, a lot of questions from instruments and surgery, and lesser questions from plaque control, pockets, TFO, but that doesn't mean you are going to neglect these topics. Now this is an easier approach once you know which topics to focus on, and in order to make it further simpler for you, so as you can see here, you have all the tasks in perio. Now the first thing that you must do is prepare the task if you are not very well versed with that topic. For example, suppose if you want to start on perio microbiology, you go to prepare, and then it will show you all the subtopics in each of these tasks. You go to workbook, then you can look at the bites, look at the explanation, images, tables, flowcharts, and if you have the workbook, even better, you can start filling in your workbook. It will give you a good practice and you can start making your own notes right from the beginning. Once your approach here is clear, once you are clear with that topic, just go through all of them one by one and then start practicing tests. So you see practice questions over here. This will give you a good practice of these questions. Now these are all basic building blocks. The tasks are your foundation. You must practice these questions and then take the test. Now when you take the test, you will find explanations, key concepts, again video explanations of the multiple choice question. Make sure that you are taking down the notes from each of this in your workbook. And now I will tell you how to maximize your preparation with Meritor's app. Now there are 5 things to keep in mind when you start your preparation for any subject at any given point of time. Number 1 is to start with tasks. Like I said, tasks are the building blocks. They are your foundation and fundamental for any subject. You need to start preparing for the task with the workbook. You must look at the video if you have any doubts regarding the topic, and then practice questions. And then you can take the test. Now whenever you are taking a test or practicing questions, each question comes with the answer, explanation and key concept. The explanation will be elaborate. It will tell you everything that you need to know about the topic. It is a good source of taking down notes because a lot of additional questions can be asked from the existing explanations, right? And if you are well versed with the topic, you can just look at the key concept and reinforce the topic in your mind. Additionally, a lot of questions also come with multiple choice question videos, which are explanatory videos. They are going to talk about how to eliminate options, how to strategically focus on the question, and additional knowledge that comes with the topic. So your first aim should be to complete all these tasks for a given subject and then move on to the next thing, that is Q bank. Now Q bank or question bank is a collection of high yield extensive questions. They are clubbed together in topics. They are clubbed together chapter wise, and you will have more hands-on experience on difficult and extensive preparation on these questions. Again, they will come with explanatory videos, explanations and key concepts. So once your tasks and Q bank for a given subject are complete, you are good to appear for the weekly checkpoint tests. Now the tests are of 2 types in the app. One is the weekly checkpoint test and self-paced test. I'll tell you about the weekly checkpoint test first. So suppose if you are preparing one subject over the week, then at the end of the week you will have a test which is going to focus on that specific subject, plus the subjects that were previously prepared, right? So that kind of snowballs the entire revision strategy. You will have a repeated encounter of multiple subjects from time to time. So you do not forget. It's easier to keep these topics in mind when you constantly see them. So the revision is reinforced. Plus, you also get personalized AI recommendations, right? So at the end of your test, based on your performance, you will get how many questions you answered, what was the score, how much was the negative marking, where are you lacking, what are your stronger points, and then it will tell you how much time to dedicate for a revision of your weaker subjects. So with this strategy, you will be able to focus on specific areas that are your weaknesses. Now that is an exceptional feature of Meritor's app. And the next set of tests is self-paced test, which you can take at any given point of time. These are subject-wise tests. You can also have cumulative tests, multiple recall questions also incorporated in form of tests. And towards the end of your preparation phase, you will have a lot of volatile, factual, high-yield questions in form of final strokes, which are again specialized tests to be able to remember these topics clearly before the exam. Now, once you come closer towards the end of your preparation, you will have access to this special feature of the app called Marathon. This is activated towards the end of your preparation, where you will have 3,500 plus high yield questions. High yield questions meaning they have the chances to be seen in the exam, because either they are based on recall questions or because they are based on important concepts that are repeatedly seen in the exam. So when you practice these 3,500 plus questions, you will also enter an all India competition where you will get a fair idea as to how your performance is with comparison to your colleagues. It's a great boost of confidence if you take it at the right time. And lastly, we have the all famous national mocks, which is a pan India or all India nationwide simulation of NEET MDS exam. We conduct them towards the end of your preparation in a few months to go. And every weekend you will have access to this special test. You will see a lot of new questions in national mocks which are based on important topics. So do not miss national mocks, because it gives you a good hands-on experience of the exam. It gives you an idea of time management, because this is exactly according to NEET pattern, that is 240 questions and 3 hours with negative marking. So you kind of get a very fair and square idea of your performance, because this is again an all India competitive mock exam, and you will get personalized AI recommendations here as well. Now they are more important for national mocks too, because towards the end when you are revising, you will not know which subject to pick up at what time, and your performance in the national mock will be assessed thoroughly, and you will get your AI recommendations which will tell you which subjects to revise. So make sure that you are making use of all of these features in the app. Now, apart from that, if there is any query that you have while solving your questions, if you have any doubts regarding any topics, you can always contact the faculty on the WhatsApp group. We are always here to help you. And I hope with this in mind, you will be able to channelize all your preparation strategy in the right direction. And I hope we'll be able to help you achieve your dream seat in MDS. Thank you so much and good luck from Team Meritors.